Hey everyone, welcome back to the Founder Series, where we talk about the business of medicine, the biology of midlife, and how to build a life and body that carry you into your next decades with confidence. I'm Dr. Rebbecca Hertel. I'm a board certified osteopathic family medicine physician, a certified menopause practitioner, and founder of Osteopathic Midlife Health, where we care for patients virtually across multiple states. Hi, everyone. I have a very special guest with me. This is Dr. Christine Hart-Kress. She is a seasoned healthcare leader with over 30 years of experience in women's health. Retired Colonel Kress served 27 years in the Air Force as a nurse practitioner and healthcare executive. Board certified as a Menopause Society certified practitioner, she has advanced training in hormone prescribing, sexual medicine, and the care of breast cancer survivors. Dr. Hart-Kress' passions lie in transforming access to high-quality care for women in midlife and menopause. She is the CEO and owner of a specialized telemedicine practice focused on comprehensive midlife and menopause care. She's an active member of National Association of Nurse Practitioners in Women's Health, serves on the advocacy committee and the conference planning committee for the joint NPWH, an International Society for the Study of Sexual Health in Women's virtual course. Dr. Hart-Kress has co-authored several key resources, including the NPWH's Scope of Practice and Health and Healthcare of Midlife Women position statements. She has received numerous accolades for her clinical excellence and leadership, including the Air Force Medical Service Advanced Practice Nurse of the Year and Tucson's Fabulous 50 Nurses Awards. A published author in the field of women's health, Dr. Hart-Kress has been featured on multiple podcasts and blogs, sharing her expertise and insights. She also serves on two boards, the Bite Me Cancer Foundation and the Empower Scholarship and Fund Board. Dr. Hart-Kress is also the co-host of the podcast, The Dusty Muffins.
Yay.
Hello.
Hello.
Thanks for
The
coming
best part
on.
the best part about that whole rundown reminds me I need to go shorten that.
No, it was so good. I was like, damn, she's good. She's smart.
I
So this is really great. Normally, everyone sees this on the Dusty Muffins. She is one of my minnow besties, and she is two of the three of us on there. So I love that you're joining me for the Founder Series, where we talk a little bit more about like the business aspect and also experiences in medicine. I think up until now, I've just been able to give personal experiences as a medical student and physician in that space. And now I'd love to hear your experiences as a nurse practitioner and maybe just explain exactly what that training is all about. Because I think there's a lot of people that don't understand just how much training is involved.
Yeah, so, back in the day, so I graduated a long time ago, and so the expectation was if you were a nurse that you needed to go hit the floor for at least 5 years and get more clinical skills and really just learn how to work within a healthcare system, how to work with physicians, how to problem solve, how to do good assessments, and then go on to NP school. So I think these days, a lot of nurse practitioners are going right from nursing school right into MP school.
And how
I
long
think
is that? So how long? So undergrad, bachelor's of science, and then into nursing, or is it a combined program? How does that work?
there are some bridge programs that will go one into the other, but there are most of the programs are the 4 years bachelor's, though there are some programs where nurses will come in with other degrees, other BSN degrees, and then they'll do a bridge into their RN that may take 2 years of full time, all the time going to school. I did the traditional 4 years Bachelor of Science in Nursing program. And then I spent 5 years as a labor and delivery nurse. And my original plan was to go to midwifery school. And I even applied for midwifery school. And at the time, my commander had to break the news to me that the Air Force decided to stop training all midwives.
Really? I don't even think I knew that.
Yes. So I was pretty devastated because that was always the goal, deliver babies, be a
Okay.
midwife.
So fun.
But, I mean, there's not a lot of babies being delivered in war zones
Yeah.
purposefully, right? So
w-
it wasn't a huge readiness skill. And so they said, well, you have two choices. Or like you can cry, or you can be a women's health nurse practitioner. And I was like, You mean do GYN? And because that was where most of the bases, it was mostly GYN. Very few Air Force hospitals actually had inpatient platforms. So I was like, do GYN. I think the only thing that excited me about women's health at the time was delivering babies. And then when I was told I was going to be doing all GYN, like majority GYN and OB, I had to think about that. My husband was finishing school and I needed another year where we were. So I was like, well, I guess y'all have decided for me because it's either go be a women's health nurse practitioner or you have to move.
Yeah.
So I was like, all right, well, I guess you decided. Interestingly enough, and I'll come back, it took me about 3 years to realize that I preferred GYN over OB. So
Yeah.
I was glad that I didn't become a nurse midwife. But it took me a little bit to do that. So NP school, I went to at the time when I went to the program, uh, my MP program was 20 months full time, summers. And it was a glorious time because I was getting paid my full time salary by the Air Force. I had a 3-month-old baby at the time. I know my
Mhm.
my dad, when I told him I was pregnant, he's like, "I thought you were gonna go to nurse practitioner school." I said, "I am." He's like, "With a baby?"
Yeah. We
I'm
can do
like,
some pretty cool stuff.
"Well, considering the kid's coming and I'm going to school, I
Yeah.
guess
Yes.
we're gonna take him." And it was absolutely perfect because I got to spend the first 20 months of my son's life. I mean, I went to school and I went to clinicals, but I got to be way more of a hands-on mom and
Yeah.
way more time with him than I would if I had been a labor and delivery nurse,
Oh,
doing.
yeah. That's what I did with my oldest too, is when I was in medical school, like, I studied from home. So, I mean, I was with her all the time and then studying, and so, yeah.
Yeah, it was great. I tell everybody, "Yes, you can go to NP school and have babies. It is fine.
Yeah.
You just learn to be really efficient when they're napping,
You do,
and you put them to bed."
100%. Yes, you have to be, right? Because otherwise you don't get it done. So what's interesting, so now you went into the military. Tell me where the military came in your undergrad training, and, like, did you go into the military and then they paid for your undergrad and that's how you did that?
So, I was on contract with the Air Force, from my sophomore year in, nursing school. I
Okay.
received a 3-year scholarship. I committed
What
in
made you
in
decide to do that?
And honestly, I had a boyfriend in college or in high school that was super, super smart, and all of the services kept trying to get him to like apply for scholarships. And I had a really bad freshman year, like a really bad freshman year
Of
that I
college?
then had to recover from academically.
Yeah.
A
Uh,
bad academic year.
I'm same.
So, I was just, like, annoyed because and I'm not a good standardized test taker, so I didn't do great on the ASVAB. So, I was in nobody's short list to pay for school. So, but then I went to an out-of-state school, and so I knew that the tuition was gonna go up, so I
Mhm.
joined ROTC, and I loved it, so they said, "Do really well your freshman year." I finished my freshman year, number 1 in my class, and got my scholarship. So I was like, all right, well, that worked out for me. And so I loved the leadership aspect and I loved organizing things and executing. And, it was a big camaraderie. It was just a group of people, mostly guys. There weren't that many women in ROTC, but, it was this whole a whole group of people that you could count on. And when I grew up in high school, I wasn't the popular one. I was a band geek. Uh, I had my
Nothing wrong with
friends.
band geeks.
I was. And,
Me
like
too.
I was friends with all like friends like, "Hi, we're in class,"
Yeah,
but I never really felt like I had like this big social network because I didn't do sports. I
yeah.
wasn't, I did drama and I did band. So Nerdville, right? And so when I was in ROTC, it was like I was popular, probably because I was one of the only females.
But it was a community.
But I had this
It's a network.
community.
Yeah, yeah, which I think is really important, and that will end up, like, leading us
Mhm,
later in our
mhm.
conversation about having a community for sure. What instrument did you play? because I was a band geek too. So
Piccolo.
that little freaking thing,
What'd you play?
clarinet.
You were behind me in the second row.
Uh huh. Sure was.
Well, actually, no, the clarinets and flutes met up in the middle. Yeah,
Yes, you're right.
in
Nope,
the
you're
first
right,
row.
you're right.
Yeah.
Yeah, forever. Oh my gosh, I loved it. It was so much fun. I was 100% band geek Ola
I
for
know.
sure.
Well, they went on trips.
Yeah, it was a lot of fun. I
Yeah, and we
enjoyed
all know
it.
what happens on the band trips.
Lord,
Like
yeah. I mean, I really was a good maybe with you. So for those of us out there, so when you go into nursing school, it is that is your undergrad. Like you go to school for nursing. That is your Bachelor of Science in Nursing. That's your
correct.
4-year degree. And then you go on to nurse practitioner school, which is 20 months or 24 months. It's
Depending on your program, and
depending
that's a Master's of Science in Nursing.
the nurse practitioner.
The nurse practitioner and some of the nurse practitioner programs, like your CRNA programs,
Yeah.
are doctorate of nursing practice. I did go on
Yes.
to
How
get
did
my doctorate, but much it's like I retired from the Air Force and I was at home on terminal leave, and one of my very good friends was like, "I think we should go get our DMP." I'm like, "I just retired. What am I gonna do that for?" And so she's like, "Well, I signed up." And I'm like, "Well, I guess I'm going." So I did it.
so tell me what's the difference between that? Was and how long was that?
So that program was 2 years, and so I did the doctorate of nursing practice, which is, different than PhD in nursing.
Mhm.
So a PhD
Okay.
in nursing, they're conducting research. In the doctorate of nursing practice, we take their research and apply it to clinical practice and then provide the feedback about whether or not their research actually works in
So it's like
practice.
applicable.
Right. Yeah. Can
Okay.
you do that?
Yeah.
Do you have good outcomes? So our job is to take all the research, use it to change practice outcomes.
Okay.
So
And then what about practicing? I've talked a lot about just kind of like how this hazing in medicine is for, med students and residents by attending physicians, and hopefully a lot of that has changed. Although I have a 3rd-year med student and I think it just depends on the rotations and where you're at. It's probably not as bad as it was. But what about for nursing? Do you guys experience the same stuff, or is it just more working, with is it with other nursing students or attendings, or is it physician attendings that are just not nice, or kind of how is that community when you're a student and training?
yeah, I would definitely say, nurses get, a lot of grief, right? Like everybody has heard of nurses eat their young, and there is some of that does occur. I think that nurses sort of forget very quickly what it was like to be a
Mhm.
novice nurse. And so they're not very patient or kind often to their new nurses. I think as a nurse practitioner, and so I trained in the civilian healthcare system. I was in
Okay.
Richmond. So I did not train in the military as a nurse practitioner. I came out for 18 months or for the 20 months. And so I had all civilian nurse practitioners, except my primary care family practice rotation was a physician in his private practice. I had two different private practices. And I found that the nurse practitioners were phenomenal. And, I think that nurse practitioners precepting is much different. And the way that you are received by nurse practitioners is much different when you're a nurse practitioner student. They're very supportive, and their goal is to get you as much practice, as much interviewing skills, as much things that they can show you, teach you, and allow you to do. So very supportive. And I found that the physicians, whether they were OBGYNs or family practice or primary care, the same. Like I never once felt hazed. I mean, I was
That's good.
scared out of my mind. I was
Yeah.
like,
So it's so scary.
yeah, I was like, "Is this a dream?" I'm like, "Am I really allowed to do this?"
Yeah. They let me in, right? That's the imposter
I
syndrome, right? Mhm.
But, nurse practitioners aren't allowed nurse practitioner students don't do much under the watchful eye of a nurse practitioner. So we don't get, I think, the same level of autonomy as what I saw when I would train residents or medical students. I think they get a little bit more autonomy than we do. So it's really a shoulder to shoulder pretty much for everything. And so I just felt them to be very, very supportive. And even in my initial years of being a nurse practitioner, I was fortunate that I was in my first OBGYN practice was an OBGYN residency. And they were kind enough to allow me to do everything that the residents were doing in terms of education. And so they closed the clinic, and the nurse practitioners attended the same grand rounds that the
That's
residents
awesome.
attended. And then every time we were seeing patients, there was one attending. His whole job was to come to you or for you to come to answer questions. And we were taught to present our cases just like
Just like
just
the
like the physicians are taught. And, I think that is very much a military thing
Mhm.
because when I was a nurse practitioner, I did not, on the civilian side, I did not see that case presentation. Like other nurse practitioners did not learn that. So I think I was really, really fortunate. But I'll tell you, that first year out of practice, I cried more days than I did not. I
so
was
scary.
so overwhelmed. I was like, I was not trained. I don't know how to do this because, the one thing as a nurse practitioner, it might have been over my school or the state of Virginia. It was so long ago. I was not allowed to do any what I call tactile things. So I didn't do like put an IUD in, do an endometrial biopsy, do a vulvar biopsy. Like I did not learn any of those skills. When I was in nursing school, the only thing that we did were shots and catheters, no like NG tubes. And
Mhm.
so there is a lot of skill, like those technical skills that you've got to learn almost immediately. And so, I think that is, probably where we don't do a good job in preparing nurse practitioners to launch into practice. And so having that time to have that dedicated preceptor. And I have heard horror stories where people have gotten, maybe, a week of following someone and then they're like, "Hey, here's your 21 patients, 27 patients. Good luck, Chuck."
Yeah, which is awful, right? It's super overwhelming. Like it literally is like drinking from a fire hydrant when you get like
Mhm,
launched into
mhm.
that. You're just like, I always think about that, in med school and your fourth year, you feel like you're super, super smart and can do anything. And then your first year of residency, you're like, I don't even know how to write for Tylenol, you know? And then your last year of residency, you're like, yeah, I can do anything. Those were probably the smartest notes ever. And when I go back at those like very beginning notes, as an attending and then it's just like that whole cycle over again. And, it's that imposter syndrome. It just, to a point, you just wonder, does that ever go away?
I know, and then there's just one day where you're like, "I got it. It's
Yep.
repetition." Like
Yep.
I have my spiels and I know how to educate and I
Yep.
know who to ask, and I don't care anymore that I have to ask my question that is probably
Right.
not, I probably should I think part of it is you always think, "I should know that."
Yeah. But then that like 5 other people are like, "Oh my god, I'm so glad you asked that. I had no idea." I agree with you, and when you start kidding other students and, you're building a practice, your patients are confiding in you and getting better, and you build those relationships, and all of a sudden you're like, "Yeah, okay, this is cool. I got
Mhm,
this."
mhm, mhm.
And so that transitions then into, okay, so you've done military, insurance-based model practice recently, celebrated your 1 year of launching your own private practice. So what are some differences that you've noticed between insurance-based model? What are some things that were difficult for you to get used to when you've been in this insurance-based model for so many years, and then in the military no less, the difference maybe between those 2? And then now you're in a private practice, cash only practice, and navigating those changes.
Mhm.
It's a different mindset.
Yeah, I know when I transitioned from military to civilian healthcare, like I one of the things that I used to feel really bad about was making patients come back because they had to pay a copay. Or was very much used to, whatever the patient came in for, you just took care of all of it because it would seem at your annual visit, if you're a person who doesn't seek healthcare often and, doesn't have a whole lot going on, that you would, talk about some of like you would talk about, hey, I was having some spotting during your annual exam,
Right.
or hey, I want to have menopause counseling during my annual
Right.
exam.
Right. They're
Y-
coming in with everything because they only see you once a year.
Correct. And like intuitively, as a woman, I mean, if I'm not going to talk to you about what's going on, what
Why am
am
I
I
coming
here
in?
for? Like, just to spread my legs and to
Right.
go, which is
Right.
what the insurance is paying for.
Correct.
A bikini exam, do the
Yes.
breast exam,
Yep.
do the pap smear,
Everything else
and
is free if you talk about anything else.
then we're gonna
I mean,
bill you
yeah.
at a problem visit, and there's gonna be a copay, right?
Correct. Yep.
So, I think that was my biggest transition, and then, of course, you know, I I've never paid for healthcare. So, that was and then, like, hearing what people pay for healthcare and what they pay for copays and paying for medications. So, that was really, I think, eye-opening for me, and then when I transitioned into telemedicine before I opened my own practice, I had the same mentality. Like, I will take care of everything that I possibly can in this 30 minutes because I was trying to prevent patients from having to book another appointment because I knew it was an out of pocket cost.
Yep.
And, it took me now probably about a year and a half that I'm like, you know what? This is not the right way to deliver medicine, to deliver healthcare. Sometimes you need to be seen more often. And I know you're getting way more education and comprehensive care in the hour new visit or the 30-minute follow-up visit than I possibly gave you in the 15 minutes that I hoped you didn't ask me any questions during
Right.
your annual
Because
so
you
I
were
could.
always already behind, right?
Yeah, because 'cause
However
I'm
many
I'm like,
patients.
"I don't have time."
And I think the other thing too is, when you build a small, whether it be telemedicine or not telemedicine, but a small concierge practice, the point of that is that you keep it small. So that way you are available to your patients the way that you want to be and then the way that they also want you to be. And there is a cost to that. So, I mean, you have to be able to pay your bills and your overhead and all of that. So if we have a practice of 100 patients or 200 patients or whatever it is that you want,
Mhm.
and then the ability to give them your time and do all of the care that we want to do the way that we do it. There is a different cost to that to be able to be available like that.
And the one thing that I have learned is that our cost is not anymore and often less than what we were billing the insurance
Mhm,
company.
mhm.
For an annual, you're billing the insurance, your regular insurance-based provider is billing your insurance company at a much higher rate than what you're paying for in a concierge or boutique practice.
Yep.
Whether they get all of that back or
Right,
not depends on the insurance.
right,
I mean, our healthcare in our practices, our costs are not more than what the
right,
insurance-based providers are billing for their time. So, I mean, I just think healthcare is expensive in providers, especially, you get seasoned providers. I mean, it doesn't matter, right? As soon as you have thousands of hours in training and conferences. So you have all of that, but then you add a provider who's been doing this like you and I for 20, 30 years. I mean, you know, it, our brain does have value.
yes, yes, just like a seasoned, I would say, like, okay, let's take a seasoned attorney that's been
Attorney.
doing it for a long time. When they first started, their hourly rate was not as much as what they are 15, 20, 30 years out, right?
Right, when they're a partner. But
Correct.
who do you want probably
Yeah.
the partner. And, I'm sure you can find a great junior partner, but there is something to be said about volume of patience and what and that learning that you get from seeing volumes of patients and how you can tie things together to help patients, live a healthier lifestyle and help them with longevity, which is what we are doing in our
Yep.
practices.
It's so much more fun than being at that back end trying to clean up, a problem when it occurs. It just seems to make so much more sense to prevent it from occurring in the first place. And what's interesting is I think that what's opened at least my mind, and it sounds like yours as well too, is like you said, the cost. Like when we go and order labs for patients who don't have lab coverage through their insurance, and it's pennies on the dollar how much it costs to just pay it out of pocket. And I do have some patients who have these high deductible plans, and they're just like, I'm not going to go through my insurance because, they're not getting the same rate as if I were to order it for a cash base. I mean,
No.
things like CBCs that are $3, you're paying way over that if you're going to use your insurance. And it was just so eye opening, even to me, just to be like, oh my gosh, this is
Well,
a racket.
I had a patient today who said, was asking about some other options for her next set of labs. And I said, well, how much did you pay? And we ordered things like a lipid panel, a B, a D, a CBC. She was a weight loss patient. So an insulin and a few other things. She's like, Out of pocket, I paid $350. And
Right.
I looked in Quest to see what their bill rate was, and it was $2,000 if she were to pay Quest directly. With her deductible, with her insurance coverage, her cost was still $350. And then if I had ordered, I told her, I said, well, next time, I said, I'll order it on full scripts. That would have cost $55.
Isn't it crazy?
It
It's
is.
mind blowing. It's not even a small amount. I'm
No,
just
and
like,
to go to Quest.
yeah, it's $10.
To go to the
You're going to
same
the same
lab.
place. It's
Right.
you're just not using your insurance. I know it's insane. I always use the example when my youngest son had pneumonia a year ago, and our out of pocket cost was $400 for a chest X-ray. And when we talked with my colleague who's his pediatrician, and he's like, it's $3 if we would have just. So we'll do that next time out of pocket. And I'm
Yeah,
like,
I mean,
okay.
sometimes it just and that's what I hear from my patients is
Mhm.
it just doesn't pay to use insurance because, even if let's say, you go to your primary or you go to your OBGYN and you start working through menopause. So you get your 10 minutes, 12 minutes, seriously, in some practices, it's like 7.5 minutes.
Or 5 point.
Right, and they need to get out. And so what happens? If you have a copay, your provider says, "Come back in a month, come back in a month."
Yep.
It's not because we need you to come back in a month, it's because a month is a reasonable amount of time for you to come back, but then what does the patient do? Copay, copay, copay,
Right.
copay. So by the end of it, it would have been easier to come out of the network and
Yep.
see your provider to have that access. And, I think the other thing, and it's not for the patients to maybe understand, but, that face to face time, whether it's 30 minutes or an hour, is a fraction of the time that we spend on your visit because there's the time before, there's
Yes.
the lab review, there's the time after, the coordination, the writing of the note, the planning. I
Yep.
mean, I would really, and not even over exaggerating, would say that. And then if we look at just maybe there's a question in between on the portal.
Yep.
I mean, a 30-minute follow up is not over exaggerating, probably a 2 hours of my
I agree.
time
Yeah. Yep. I'd
per
agree with
visit.
that. I would agree with that.
Yeah.
And then, so lastly, I want to go over the importance of camaraderie in business. So when you have, you are going out on your own, especially, like we're not taught to do this. We're not taught the
Mhm.
business of medicine, right? This is something that I always preach, like med school and residency, they need to teach the business of medicine because we're
Mhm.
just not taught that. And so when you decided to go out on your own and you're like, okay, I think I can do this, what types of relationships have molded you to be able to go out on your own, change your processes maybe, the confidence, the strength to do different things, to try different things, to brainstorm with other clinicians. Kind of tell me how, how important that is to have, maybe it is a community of other founders and business owners, or other women or
Yeah, I mean, you, Aoife, and I all decided to, join the first telemedicine practice we were all in. We all joined at the same time, and then, got to know each other through that experience, and then all transitioned to our own practices together. I think having a group of, having you, both of you, just to bounce ideas off. And I know one of the things that's really helpful for me is midlife care is a lot more primary care than I ever imagined, a lot more than I did when I was just worked in an
GYN care.
OBGYN clinic. So even for me, just to be able to have to bounce some clinical ideas, but the relationship that the three of us have was really kind of an eye-opening experience to me, because I had not had the experience where I felt like I, was an equal in the relationship, because there were things that you all knew much, much more than I did. And there were things that I knew more
Yeah.
of, because I mean, all I've done is women's health, right?
Yep.
And so, that was really helpful from a clinical perspective, but just to bounce ideas off of each other, because again, you're not taught the business, you're trying to figure out pricing, you're trying to figure out, what is the going rate? What are other providers in your local area? And so all of us are in different parts of the country. And
Mhm.
so it was good to bounce ideas. And, we all did a little bit different in our leadership or professional development or entrepreneurial development. So to be able to be like, well, my business coach said this, and well, then I talked to this person and they said this, and then really just getting started and just trying things out. And I mean, I have changed my structure at least 5 times. Now, I didn't impact the patients that were in the structure, but
Right.
moving it, because, I need to make sure that I'm protecting my time and that I'm also, getting compensated appropriately. And so having a community is so invaluable. I think, we have tons and tons of text threads. And I think what the thing that I would like patients to understand is that those of us that are in these communities, it's not just our brain you get
Yeah.
a community of brains. We have different text threads from just 7 of us to text threads where there's 45. And,
Right.
and there is
International brains.
there is always an answer. I mean, I have asked primary care questions. I'm like, I don't know. Hold on a minute. And I'll tell the patient, and I'll be texting you or Aoife, hey, I got a blah, blah, blah. What do you
Yeah.
think? Which statin is better? I don't know.
Yeah.
And so, and working from home and working in telemedicine would be very lonely if
Yep.
it weren't for what I call all my imaginary friends, all
Yeah.
of the people that I have met on, other nurse practitioners that I've met in person at a conference. There's some that I haven't met at all. And then, you start to find your people who are similar in their approach. And then it makes it so much less isolating.
Yep. And stressful. And I think like for you, for sure, you have been in the healthcare aspect of administration and you're so good at being like, okay, these are the rules. This makes more sense from a business perspective. And I'm like, yeah, okay, that does make sense. So it really is so difficult to do this on your own without I could not have imagined not having a
Mm-mm.
support system,
No.
in particular with you and Aoife and well, Heather Quayle and the other nurse practitioners and probably more nurse practitioners actually and some other physicians I would say like
Yeah.
Kate and so it really is so important to have your community of people to help you, even if it's just to bounce ideas off of, because You know what? It's fun. It's fun to watch your friends and colleagues do well and to be successful and then to have an aha moment where they're like, that's a really great idea. I mean, I do it with Christine all the time. I'm like, that's a great idea. I didn't even think about that. Oh my God. Thank you so much. And it just makes a difference. So yeah, our patients are really getting all of these brains and not only in their care with cases that might be a little bit more difficult, but in how we are structuring and running our practice so that it's really giving them the best that we can. And if we don't feel like it's the best, we're gonna change it so that it is the best.
And, like I'll get some patients that come from other providers that maybe they work in healthcare systems, maybe they work in independent practice, but, they're people that I've never heard of. And so I'm like, who are these people? And I mean, I just think that our, 6 degrees of separation, our groups, whether it's the menopause group, the big nurse practitioner groups. I mean, like I always am confident that if I refer to any one of those providers, I know they're evidence based. I know that
Yep.
they have been trained. I know that they won't gaslight. So I've been spending a lot of time on Facebook saying, "What state are you in? I have a wide network." I don't think people understand what that means, but I
Probably
literally
not.
can find anybody in any state
Yeah.
to connect.
Yeah. It's so invigorating that we can help, patients that way just to say, because I'll get patients, and I'm sure you do too, for our like discovery calls, and all of a sudden they're not in my state. And I'm like, you're not in my state. But I'll say to them, but I can find someone who is and connect you.
Right.
And they are so thankful
Mhm.
because I think really they would be used to either, first of all, who does the discovery call to make sure that, you're a fit,
Right.
definitely not in the insurance based model.
No.
Often, I will say maybe some of the DMPs do, but that number one, and then number two, that they're texting you back and saying, I can find someone for you though, because I want you to get care. I want you to be healthy. And I think that's really important. And it's such a really neat thing that we can give to patients is to be able to say, I might not be able to help you, but I can find someone who we trust that can, or maybe that our colleague trusts if we don't know them.
Right. Because, I mean, I really do think that still one of the best resources for finding a reputable nurse practitioner, it's not the Menopause Society. Oh, by the love of it. It's not there. It is, I mean, it is Dr. Mary Claire Haber's, her
Yep. Her
website,
list.
you know. I think that's probably the best one in terms of you know, you won't be gaslit and you will be heard. And then because it's other patients that have taken the time to put
Yes.
them on there,
Yep.
so
No,
yeah.
so before we end, 2 things. Any last minute things for patients who are thinking about maybe, "Hey, maybe I wanna think about, a concierge practice." And then number 2, any last minute things for, we'll say, founding women who are entrepreneurs who maybe think like, "Can I do this? Can I step out of what I'm used to into a new role of building any type of business on their own?"
Yeah, I think for women, I think this is the time where you invest in you, where you should be ridiculously selfish. And if you are not getting the time and getting the explanations and the education and, the care that you believe you need to live for as long as you possibly can without being a burden to anyone, right? So full
Mhm.
mobility, trying to preserve your cognitive function, then, I think you need to think about, I mean, investing in your healthcare. For sure, the collection, right, of us, we are cheaper than your gym membership. And we are a fraction of what you probably spend to going to Costco. 'Cause even
That's
my
right.
family of 2 I mean, I don't get out of Costco anymore for less than
Oh
$400.
my gosh, I
So and I go
know.
every month. So, and I just
Or
think
your
that
Botox or your nails or your
exactly, it's all about choice.
Yep.
At the end of the
What do you wanna
day,
invest in?
you live 1/3 of your life in perimenopause, menopause. Think about the one woman in your life that you're like, I don't want to be that.
Yep.
I go to the nursing home every weekend and I think I do not want to be here.
Yep.
I want to have my faculties. I want to have my mobility. I do not want to be a burden to my son. And so, that means investing in my healthcare so that I can have a partner to help me get there. So, and, I think husbands spend lots of money on other things. And so spending money on healthcare in midlife may seem confusing for them. But I think when they realize how much better you are with someone that has a little bit more time, I think they'll realize it's a good investment in their marriage. And then for other entrepreneurs, I grew up in what I call the system, right? So I was told what to wear every day. I was told, I had to wear a hat when I was outside, who I needed to salute. And, so I'm very institutionalized. And
Mhm.
so the thought of being an entrepreneur was never, never on my radar. And I was a little apprehensive. Could I do this? But because I had such a good support system and I had a couple other nurse practitioner friends who had been doing this for 5 years and were very successful and were willing to help me, just
Yep.
find someone that is willing to help you, because there are people out there that are willing to, give you some advice. I mean, and there's lots of people that would like you to pay for their advice. Big, big,
Right.
big, big, big dollars. I'm still under in the Air Force, one of our jobs was to mentor. So I try to do that
Yes, I
when
think
I
it's
can.
super important. I agree with you. I think that's part of our give back to medicine, to those of us who are up and coming. That mentorship is important, whether it's business mentorship,
Mhm.
medicine mentorship, or both.
Yep. Yeah.
Yeah. So where can people find you? How do they follow you? How can they get access to your amazing care?
Yeah, Instagram at Christine Hart-Kress _DMP. I'm very original. I name my practice after myself. So ChristineHartCressDMP.com. I am licensed in 8 states, telemedicine. And so happy to have engagement, and please follow, listen to the Dusty Muffins.
Yes, yes. And I'll throw all of her stuff in the show notes as well, you guys. Thanks so much for coming on. I appreciate it on a Friday at the time of this recording, Friday, late afternoon. I
Yeah.
really, really appreciate it.
I'm
So, so
so glad
good.
you asked.
All right, my darling. Until next time, you all, thanks so much. All right, all. If this conversation resonated with you, take a moment to share it with someone who needs to hear it, whether it be a colleague, a student, a woman ready to think differently about her health and her future. If you're watching on YouTube, please make sure to follow, like, and subscribe. It's the easiest way to support this work and helps this content reach more people, more women who need it. If you're listening on Apple Podcasts, please follow the show and leave a review. Those reviews matter more than you realize and help other listeners find the series. You can also follow me across platforms for more education on all the social Instagram, Facebook, YouTube, LinkedIn for more education, clinical insights, and founders content. For clinicians, you can earn CME if you listen to this on the Pinnacle app. And if you want to learn more about how we approach midlife care, hormone optimization, metabolic health, you can find me at Osteopathic Midlife Health. So as always, this series exists to help you think differently about your body, your career, and your future. Because the next decades of your life deserve intention, strengths, and clarity. So thanks for being here, and I'll see you next time on the Founder Series.